All right, Dr. Brandon here, and today we're going to show you a little bit of a new therapy we have here at Body Mechanics called BFR Training. So one of the challenges with an injury is that usually within about 7 to 14 days we start losing muscle. And the problem is that most of your rehab exercises that you'll see, kind of those stretchy band exercises or just stuff like lifting your leg to the top, to the side, generally doesn't give us enough strain to be able to either maintain muscle or grow muscle back. And so more often than not, especially for those that have dealt with an injury, they may find that even just doing lightweight exercises or maybe going back to their old routine of lifting weights is just too painful for their hip, for their knee, for their ankle. And so BFR training lets us help you save your muscle and regrow muscle at levels that would normally not be enough to help you maintain that. And so today we're going to show you a little bit of just how some simple exercises using BFR training can actually help keep the muscle that you have and grow. And so that when you finally are able to start lifting weights again, you're not noticing that, say, hey, my right leg is so much smaller than my left leg after that injury. All right, but first we want to talk a little bit more about specifically the cuffs that we do use. We use, you may have seen maybe some YouTube videos, people using like a floss band, or maybe just using a regular blood pressure cuff just to try to do this type of training. At Body Mechanics, we use cuffs that are specific for BFR training, but we take this a couple steps further. First off is we want to make sure that we have the exact right pressure so that we're not working at pressures too high and actually causing any nerve damage, and B, making sure that we're staying on the safe side of this type of training. So obviously we never want to do any harm. And so basically our first step whenever doing BFR training, after making sure that it's the right thing for you, is finding the exact right pressure for you. All right, so for us, we use an ultrasound here, and we go ahead and take our cuffs up to where we have where we find the right pressure for each leg. So we can't just go by what the left leg is. We have to make sure we've tested both legs to make sure you're working at the exact right pressure. All right, so we've taken Victoria up to her pressure, which we found using our Doppler ultrasound. And so our working pressure for somebody that is working on their legs is roughly 80% of that pressure. And so basically what this is doing is this is making it so that muscle has to work extra hard just to get the contraction. So our first one, we're going to do just kind of a standard physical therapy exercise. It's called your straight leg raise. So you're going to there we go.
Yeah. Definitely a lot harder without anything on.
Yeah. All right, so we're going to take 30 seconds off. All right, what'd you feel that fourth round? Feels like it's about out of gas?
Failure.
All right.
Almost failure, basically.
Almost failure?
Yeah, not last rep. If I did anything more, definitely couldn't do any more.
Yeah, so that's that's one of the things we can do with BFR is we can actually challenge that muscle to make sure that we don't have that many reps in reserve. So if you find yourself, okay, I keep doing my 3 sets of 10, I'm like, okay, I'm not really feeling that in the muscle. One of the things that BFR will do is it will help us make it so that you're able to maintain and grow that muscle at much lower levels. Take a break, have a seat. How you feeling?
Pretty good, pretty good.
Adding that 15 took us close to that fewer reps in reserve.
And the way my heart rate spikes up so quickly during this, I haven't experienced an exercise like that. Normally it takes a lot more. Yeah, still a little bit out of breath.
Yeah, so for those of you watching, that was so we're getting this off of basically just 2 exercises thus far. We could add several more. We won't take you through all those just yet. But if you do have questions about BFR, looking just to get more information, reach out to us through the message us up at the top of the page, or reach out or visit TallahasseePT.com. Again, I'm Dr. Brandon, owner and physio at Body Mechanics here at Victoria, and we'll just have you watch us with a little bit of BFR training. Hi, and welcome to TallahasseePT.com, home of Body Mechanics Physiotherapy and Fitness. I'm Dr. Brandon, the owner and lead physio here at Body Mechanics. And I just wanted to start off by letting you know who it is that we help and then how to best use this site to get the information that you're looking for. So for starters, we help active people in Tallahassee quickly recover from